just make sure you're not clotting. So we're more likely to have not only inflammatory cells stick on there, but we're more likely to get clotting. And then we can get plaque formation too. So Zyrtec will make the blood vessels more slippery, which is kind of nice, right? And all that should just move on down the road. The inflammation will go to wherever it is it's going. You can deal with that later, but you don't ever want to have a stroke, while you're trying to figure out what's happening. So keeping an eye on the D-dimer is a good idea. Mine started to go up and started to go abnormal. And I went to the doctor thinking this was urgent, right? I mean, there's stroke, heart attack in my family. It was the weirdest journey. The doctor said, okay, well, yeah, I can see it's going up. Well, you haven't had a stroke or a heart attack yet, so we don't need to do anything. I was like, what? I said, you mean we have to wait for potential, life-threatening conditions? He goes, yeah, we want to see if there's a clot first. I thought that was ridiculous and way too conservative. I mean, you could just graph it and see, okay, something's getting worse. And at the time, we didn't know what was driving some of that. So I thought, well, this doctor's just an idiot, right? I went to another one, like the biggest blood disorders group in our Metroplex, same answer. And I've noticed in our antiphospholipid syndrome patients, where there's an autoimmune condition driving clotting, they get the same story. And if I was an antiphospholipid patient, they're very prone to clots. I'm not going to be waiting for a clot to start some methods of keeping the vessels healthy and the blood flowing. It may not be warfarin or something damaging, but there's other things we can do to keep that blood flowing. And I don't understand why they're so conservative on that.